The broadcast is now starting. All attendees are in listen-only mode.
Candice Fenildo, CPC, CPMA, CPB, CENTC, CPC-I, holds an associate degree in health sciences in the health sciences and is a certified professional coder, CPC, certified professional biller, CPB, certified professional medical auditor, CPMA, certified otolaryngology coder, CENTC, and a certified coding instructor, CPC-I, through AAPC. Candice has over 17 years combined experience in coding, billing, and AR management for multi-specialty physicians, including ENT, vascular, cardiology, rheumatology, and ophthalmology. Candice is an associate consulting with Vado Consulting Incorporation in Delray Beach, Florida, where she provides compliance, chart audit reviews, physicians and staff training, and specialty expertise to her clients. Additionally, Candice has extensive experience in reviewing and negotiating contract agreements with all commercial payers, including provider participation agreements and specialty carve-out arrangements. Candice is currently serving her 4th year on the AAPC Chapter Association Board of Directors, AAPC-CA, the governing body of AAPC local chapters, as the 2016 chair. Candice has held multiple positions with her local coding chapters and enjoys mentoring and guiding new members. Ms. Fenildo, welcome to the webinar. We are now ready to begin.
Thank you, Andy, and thank you for joining us, everyone. So today's agenda, I'll be discussing the state of the industry, why we need a compliance program, how we can determine what that program will encompass, where to start, ways to identify your risk areas, who should be involved in the process, when and how to perform chart audits, and lastly, how to respond to an audit to help ensure the best outcomes for your practice. So as you all know, the efforts to identify and eliminate healthcare waste, fraud, and abuse are on the rise. As you can see here on this slide, this graph shows the estimated waste in the U.S. healthcare spending, with 37% coming from unnecessary care, 22% in fraud and abuse, 18% in admin inefficiencies, 11% in medical mistakes, and 12% in preventable conditions. Now, the healthcare spending in the United States is growing at an unsustainable rate. The investigations are finding a lot of improper payments. If you see here, in 2014, the government estimated a 12.7% improper payment rate, which equaled to about almost $46 billion. And that rate actually soared from the prior year. In 2013, the improper payment rate was only about $10.1 billion. Now, some believe that the improper payment rate went up due to diminished recovery audit activity, but I can tell you as of this year and last year that audit activity has definitely increased. Now, the policymakers increasingly seek ways to slow the growth of healthcare spending or reduce the spending overall. Now, a key target is eliminating waste, as we know, which is spending that could be eliminated without harming consumers or reducing any quality of care. And to combat the waste, fraud, and abuse, the U.S. government has employed a task force of agencies. So who are these agencies? Well, as you can see here, this list is quite extensive. We've got the OIG, your DOJ, the FBI, your Medicare administrative contractors, your QIOs, your PSCs, your Medicare Zone Program Integrity contractors. We've got a host of alphabets going on here. And it continues, your Medicaid Fraud Control Unit, your State Medicaid Inspector General, your State's Attorney General, your RACs, your CERTs, and then lastly, your PERMs. So in preparation of this presentation, I found a survey launched by the Healthcare Compliance Associated. And what the HCCA wanted to estimate is the volume of audits and how they affect the healthcare institutions. And this slide here shows their findings. So if you look at this chart, the most respondents reported at least one OIG audit. And I would advise you to review the OIG's areas of concern or the OIG's annual work plan every single year. And they also come out with a revision twice a year. So I would recommend checking that to see if that might affect your practice in any way. As you can see, the second largest here was the Medicare RAC, and then third-party payers. Now, a lot of times when conducting audits, physicians would ask me, why should we be looking at commercial payer claims? Well, if you look here, this is why. Because of the success of the RACs at recuperating tax dollars, a lot of commercial plans are also beginning to use their techniques in an attempt to recover what those plans consider to be overpayments on prior paid claims. Now, the results of audits are then extrapolated over several years to determine the amount of overpayment. And in some cases, the calculated amounts are small, but for some others, as we have recently, there are millions of dollars. So let's discuss the compliance program. Healthcare fraud is a serious problem that we should all be concerned about. Your fraud includes obtaining a benefit through intentional misrepresentation or concealment of material facts. And as you saw in that first graph, your fraud and abuse takes up about 22% of that healthcare spending waste. The waste includes incurring unnecessary costs as a result of deficient management, practices, or controls, and that's about 37%. And then worstly, the abuse, that includes your excessively or improperly using government resources. So here's a few examples of how healthcare fraud can be found through data mining. I subscribe to a lot of listservs. This one specifically is the New York Medicaid Office of Inspector General. And some interesting findings here. Here's one where a woman who gave birth to a child and then 5 months later gave birth again. So these are the findings that they come up with when they're doing the data mining on claims. Another one is children under the age of 10 that were giving birth and claims were sent in for. And then lastly, here's a 50-year-old woman who gave birth with no fertility treatments. And Medicaid also stated here they recovered $500,000 on this one alone. Now, the FBI statistical reports estimate that fraudulent healthcare billing accounts for about 3 to 10% of all healthcare expenses. And as you can see here, most of them come from billing services that were either not rendered or not necessary, upcoding services, filing duplicate claims, unbundling, your medically unnecessary services, and also kickbacks. Now, Daniel Levinson, as we all know, he's our Inspector General from the OIG, he stated that they expect every healthcare provider to have an effective compliance program. And that key word here is effective. I mean, I've walked into many practices that, have your so-called compliance programs, but you know what they are? They're a book on a shelf. They're not effective. So the key word here is to have that effective compliance program. And if you're one of those many people who ask why you should comply, well, here are the most important reasons. Number one, it's the right thing to do. It enhances correct billing, reduces denials and claim payments, definitely increases efficiency within your practice, and reduces the risk of an audit and minimizes that risk of overpayments within your practice as well.